Are your hands constantly numb or tingling? Does the numbness in your hands keep you up at night? Or does that tingling sensation stop you from doing the things you love? Are you tired of searching for answers and finding nothing but confusion? You're not alone. This video will review the main causes of numbness and tingling in the hands and show you exactly what to do to get lasting relief, quickly and safely. We'll take a closer look at each possible diagnosis, from carpal tunnel syndrome to nerve damage, vitamin deficiencies, and beyond. You'll learn not only what could be causing your symptoms, but also why it's happening, and most importantly, what you can do about it. With years of experience in diagnosing and treating these exact symptoms, I've seen it all. I've guided countless individuals like you toward understanding their conditions and finding effective treatments. My goal is to cut through the misinformation and give you the straightforward, actionable advice you need so you can finally put your health concerns to rest. By the end of this video, you will have a crystal clear understanding of the most likely causes of hand numbness and tingling. You'll know exactly which steps to take next, whether that's a simple home remedy or seeking out a specific type of healthcare provider. And be sure to watch until the very end, because I have a special bonus for you, a simple remedy that you can do at home to start relieving that numbness and tingling in your hands. So keep watching. Hi, I'm Dr. Ole Olson, America's neuropathy coach. For nearly 20 years, I've been helping patients manage peripheral neuropathy without drugs and surgery, and training doctors nationwide on effective treatments. I founded Asuta Health with 5 clinics across the Midwest dedicated strictly to healing neuropathy patients. My goal is to make this the top YouTube channel focused solely on peripheral neuropathy, and here's why. My journey began years ago when my father suffered from a herniated disc, causing severe nerve damage in his leg. I vividly remember his words. I wouldn't wish this on my worst enemy. Watching him struggle with everyday tasks like getting dressed and driving his car ignited a fire within me to find better solutions for nerve damage. This personal experience set me on a path of relentless learning. I traveled across the country studying under renowned experts and attending advanced neurological training centers. Before I dive in, go ahead and smash that subscribe button below if you want to join this community and look for breakthrough methods that can significantly reduce your neuropathy pain and improve your daily life. In addition to this, I wrote a book called Reversing Neuropathy: Key Components for Getting Your Life Back. You can get a free copy at the link in the pinned comment below. Before we discuss the causes of numbness and tingling in the hands, let's first review the anatomy that's involved. The brachial plexus, it's a network of nerves leaving the lower part of the neck, is formed by the 4 cervical nerves, C5, 6, 7, and 8, and the first thoracic nerve, T1. This plexus passes from the neck into the armpit area, the axilla, and supplies the nerve to the shoulders, arms, and hands. Here are the main causes of numbness and tingling in the hands. First, nerve compression. Nerves can become compressed or pinched due to various structural changes or repetitive activities. When a nerve is compressed, its ability to conduct sensory information to the brain is impaired, leading to sensations of numbness or tingling. Common examples include things like carpal tunnel syndrome, which is compression of the median nerve in the wrist. This can cause things like numbness and tingling in the hands and fingers. Cubital tunnel syndrome, compression of the ulnar nerve at the elbow. Thoracic outlet syndrome, compression of the nerves or blood vessels between the neck and the shoulder. And also the cervical spine compression. Conditions such as disc bulges, disc herniations, degenerative arthritis, and abnormal spinal alignment in the neck can all compress nerves as they exit the spinal column. This type of compression can significantly impact the nerves that feed into the arms and hands, leading to numbness and tingling radiating down from the neck into the hands. The next cause is peripheral neuropathy. Peripheral neuropathy is a result of damage to the peripheral nerves, which are those nerves outside of our brain and spinal cord, specifically into the arms, hands, legs, and feet. This damage disrupts the normal functioning of the nerves, impairing their ability to transmit signals properly. As a result, individuals may experience abnormal sensations, such as numbness, tingling, pain, or weakness, primarily in the hands or feet. Common causes of peripheral neuropathy include things like diabetes, the most common type of neuropathy. This is due to prolonged high blood sugar levels that damage the nerve fibers. This type of neuropathy typically affects the feet first, but it can also cause symptoms in the hands. The second is autoimmune diseases. Conditions such as lupus, rheumatoid arthritis, and Sjogren's syndrome can attack peripheral nerves directly, or they can cause conditions that lead to nerve damage over time. Vitamin deficiencies. Lack of essential vitamins, particularly B vitamins, B1, B6, B12, vitamin E, and niacin can harm nerve health, leading to neuropathic symptoms. Fourth is infections. Certain viral and bacterial infections can affect nerve health, including things like Lyme disease, shingles, which is herpes zoster, and HIV. The fifth is toxins and medications. Exposure to toxins, including heavy alcohol use and even some medications like statins, especially those used in chemotherapy as well, can cause nerve damage. The third cause is reduced blood supply. Insufficient blood flow to an area can result in numbness and tingling due to a lack of oxygen and nutrients needed by those nerve cells. This can be seen in things like peripheral artery disease, or PAD, which is a narrowing of the arteries, reducing blood flow, commonly affecting the legs. Raynaud's phenomenon. This condition causes blood vessels to narrow, often in response to cold or stress, affecting the fingers and the toes. The fourth cause is inflammation. Inflammation in tissues surrounding the nerves can lead to compression or direct damage to the nerve fibers. Inflammatory conditions like tendinitis or bursitis can cause transient or chronic tingling and numbness if nerves are affected. If you're experiencing numbness or tingling in your hands, it's important to address these symptoms promptly. These sensations can be a warning sign of a more significant underlying health issue. Steps to take. First, consult a specialist. Schedule a visit with a healthcare provider who specializes in nerve conditions, such as a neurologist, a chiropractor, or even a physiotherapist. Secondly, your doctor should conduct a thorough examination of the nerves, and he may ask about your medical history and any recent activities that could be affecting your nerves. Third, depending on your symptoms, your doctor might order blood tests, nerve conduction studies, or imaging like x-rays or MRIs to pinpoint the cause of your issues. Fourth is to get a clear diagnosis, which is crucial to determine the treatment approach. And fifth, treatments could include anything like medications, physical therapy, chiropractic adjustments, exercises, supplements, and even lifestyle changes. In some cases, more specific interventions like surgery may be necessary. Promptly addressing these symptoms helps prevent potential nerve damage and improves treatment outcomes. Early intervention is key to managing your condition effectively. As promised, I've got a bonus tip for you. Well, actually 3 exercises for you, depending on where you feel your symptoms. The first one is median nerve flossing exercise. Typically, symptoms are felt in the thumb and the first couple of fingers when the median nerve has been impacted. You're going to start with your hand with your palm up, like you're holding a tray. You're going to slowly start to straighten that arm out, flexing the wrist as you extend. Bringing it back. If you'd like to add more of a sliding action to the nerve, you can actually tilt your head toward that same shoulder as you extend the arm. You can repeat any of these exercises up to 10 times a day, but start slowly. While increased symptoms can be normal with these movements, we would like to avoid too much of a flare-up from overdoing it. The second is ulnar nerve flossing exercise. The ulnar nerve will produce symptoms more on the pinky side of the arm, including the last 2 fingers. This one will feel and look a little weird. You're going to start with your arm straight out, palm down, thumb and index finger slightly touching. Keeping your arm straight out at 90 degrees, you're going to bend your elbow and you're going to try to take and circle your eye with your fingers, that thumb and index finger, and then go back out. You don't have to make it all the way, just until you feel a slight symptom increase and or a stretch. The last one is radial nerve flossing. For the radial nerve, you tend to feel symptoms that focus more on the back of the hand and the forearm. This nerve tension starts with your hand down at your side, your wrist straight and palm facing behind you. Next, all you have to do is flex that wrist facing the palm up toward the ceiling. Back down, and then flex it up. This is called the waiter's tip position, or baton pass position if you're a track and field person. Don't take numbness and tingling in your hands lightly. If left untreated, it can lead to chronic pain and reduced and limited function. I want to hear from you. What has been your experience with numbness and tingling in your hands? Share your thoughts in the comments below. Your engagement not only helps you, but also others who might be going through the same thing. By sharing your story, you help build a supportive community where people from around the world can connect and support each other in their journey with peripheral neuropathy. If you found value in this video, please like and share it. And don't forget to subscribe to our channel. My goal is to make this the top YouTube channel dedicated to peripheral neuropathy, providing support, tips, and guidance for everyone affected. The perfect video for you to watch is 5 exercises to help improve balance in peripheral neuropathy. Go and watch this video next.